think the work that is being done by AAKP is so critical to patients all around the country. Their ability to advocate on our behalf ensures that everybody understands the impact of kidney disease and what they can do to help us.
I always have fun at an AAKP event. How could you not have fun? You're with people who understand completely what you and your family are going through. So it's not just for patients, AAKP. AAKP should be for the family of patients, because when a patient has kidney disease, the family has kidney disease.
Belonging to an independent advocacy organization like AAKP gives me the confidence that I can represent them and people living with kidney disease to represent them honestly.
Our objective over the coming decade is to reach people around the globe and not just limit it to the United States, because kidney disease is a universal disease.
They encourage patients to be the voice for their care and treatment. And I don't see that as much in other organizations, and I feel like that is so necessary for patients to feel like they have a voice and they can make change in regards to their care and treatment.
It's important to be a patient advocate because to whom much is given, much is required. I was given this gift of life back in 2008 by my donor, Leanne, rest in peace. She was a deceased donor. So now if I can use my voice and use my platform and influence to impact lives, and my favorite word, why not? And why not become an organ and tissue donor today?
We spend a lot of time here, particularly in DC, in the nation's capital, talking with staff, with the legislators, and trying to help them understand exactly what the patient perspective is on anything that's kidney or renal related. It's a great honor to be able to do it. Our numbers are growing, and part of our strategy is for them to understand that we will come and visit and talk with them, and we represent the patient voice, and we want that to be heard, and that's how we do it.
People around the world who are sick and suffering with kidney disease need a voice of optimism, they need the tactics, and they need the reinforcement from fellow patients here in the U.S. to do what they do and demand a change in the status quo. And we fully intend to arm patients around the world with the tools they need to be more vocal with their governments, regardless of the ideology of their government, and to demand solutions and to defend private sector companies and investors who are willing to get into this space and deliver more innovation for patients.
AAKP opens the door so that it broadens the whole horizon. You're one person. When you belong to AAKP, you suddenly become a tribe.
Welcome to today's HealthLine webinar, Coronavirus and Kidney Patients Update, a CDC expert webinar hosted by AAKP's Center for Patient Research and Education. Thank you for joining us today for an update from AAKP's trusted federal partner, the Centers for Disease Control and Prevention, including the importance of the COVID-19 vaccination and virus variants in the context of vaccination. My name is Erin Kale, and I am Director of Stakeholder Operations for the American Association of Kidney Patients. I oversee our patient education and grassroots engagement activities, including our Ambassador Initiative, which comprises highly motivated and engaged patients and caregivers around the country and globe. These individuals have a direct connection to kidney disease and wish to raise awareness and provide support to others navigating the challenges of this chronic disease. AAKP's HealthLine webinars fall under our Center for Patient Research and Education. We believe patient and caregiver education is an integral part of treatment and protection of patient lives, and we work to ensure that the patient has a central role in research and guidance that are designed to determine optimal approaches and strategies for providing healthcare services, assistance programs, and access to new products and services. This is especially true during national emergencies such as the coronavirus pandemic. At this time, I'd like to introduce AAKP's president, Richard Knight. Richard is a former in-center hemodialysis patient who received his kidney transplant over 12 years ago. Richard, I'll turn things over to you.
Thank you, Aaron. First, I would like to thank everyone who has shown a concern for kidney patients and the continued threat of COVID-19. Second, I want to thank the CDC for again sharing their time and expertise with us today, as well as for their responsiveness and engagement with AAKP and the kidney community over the past year through our Keeping Dialysis Safe coalition that we've jointly shared with them, and the Health Infection Control Practices Committee, HIPAC. AAKP is proud to have the CDC as one of our long-term federal strategic partners, and we're certainly honored to serve as a member of the HIPAC. As we all know, the coronavirus has been a serious threat to all Americans, especially those with underlying health conditions who are immunosuppressed, like our kidney patients. For the past year, this is something that we've dealt with. I pray for everyone who is facing or has faced the threat of this disease. As a matter of fact, it was just a little over a year ago when I was finishing up a 2-week quarantine after being exposed to COVID-19 on March 6th at a meeting I attended in New York. Since that time, AAKP has hosted a dozen webinars dedicated to different aspects of COVID-19. Today's presentation from the CDC will provide important updates on COVID-19, as well as serve as a reminder for keeping yourself and your loved ones safe and healthy. So once again, I'm asking all of you who are listening, stay connected to AAKP and share your involvement through our online efforts. Because although our reach is growing, we believe we need to educate more patients on how serious this virus is and the threat they face. But however, I want to note that the fear, uncertainty, and doubt we felt in March a year ago is rapidly being replaced with new information, a variety of vaccinations, and most importantly, hope. I will now ask my fellow transplant recipient and AAKP Chair of Policy and Global Affairs, Paul Conway, to talk about our survey research that led in part to the call today with CDC. And you should also know that Paul serves as the AAKP liaison to the CDC Health Infection Control Practices Committee, HIPAC. Paul, I turn it over to you.
Thank you very much, Richard. And for those who are listening, I want you to know that Richard Knight and I have worked together diligently for the past 5 years to make certain that AAKP brings your voice as patients and caregivers to the table in all federal policy and stakeholder deliberations on Capitol Hill before the White House. One of the technologies that we use to do that is the latest in polling and surveying techniques. Richard Knight has been very forceful here in Washington, D.C. and around the country in making certain that all voices, especially from those communities that are not heard, are heard by the federal government and by state governments and all stakeholders. On this first slide, you'll see that going into today's webinar, we wanted to get a sense of where the kidney patient community was on vaccines. The great news is this: we know as a community what a threat COVID poses. We're ignoring voices of discontent and argument on either side of the issue, and we're taking care of business. We're getting our vaccines, and that we feel as though the increase in vaccines and the better distribution is making us more confident that things will eventually become safer for us individually and as a patient and kidney community. On this particular slide, you'll see that nearly 87% of kidney patients believe that they're confident or somewhat more confident overall that vaccines and their increased distribution have made them think that America will see the light at the end of the tunnel for the COVID-19 pandemic. And this is good news. So in this first cluster of polling questions that we did, people feel better about the vaccines for their own safety, but also that it's key to making certain that America is coming out of this long pandemic. The next couple of slides paint an even more interesting picture of this, however, in the insights of patients. We asked patients, regardless of whether they had gotten a vaccine or plan to, what were their top concerns about the vaccine itself? And here are some that you would probably think are typical, which is concerns about effectiveness and long-term safety. But right there at number 3 are the emergence of new variants and mutations, such as the UK, the South African, and the Brazil variants, and the continued risk of infections. And then the the other question in this cluster was interesting because even though vaccines are available, we asked whether or not we thought that people would be less likely to follow CDC guidelines, such as face coverings and gatherings. Nearly 88% thought that even though vaccines are available, people are going to drop the common sense protections that have been recommended for the past year by the CDC. So then we asked, what do you think the three biggest risks are to continued progress that might trigger a wave of new infections or renewed limits on an individual's ability to be with a family, leave home, and return to a fairly normal life? And number one on that list is people ignoring CDC recommended guidelines. Number two is that there are more transmissible mutations, and again, UK, South African, and Brazil variants. And number three, states opening up sooner than vaccine availability. But we actually think the first two are quite important and germane to today's webinar. Finally, we asked folks to rate those leaders who we think, as a patient community, are the most credible to talk to highly vulnerable populations that may not have gotten vaccines yet, and that would have the most credibility in asking people to go ahead and get one. So for those pockets across America or in the patient community, who do you think is the most credible at communicating that message and encouraging everyone to get their shot? You can see family doctors and nurses are right at the top, leaders of the faith community, and families. At the bottom of that list are national elected or former elected leaders. And with this, I'll turn it back over to Aaron so we can get into the substance of the presentation today. Again, like Richard, I'd like to thank the Centers for Disease Control for their professionalism and their forward-leaning mentality in terms of engaging the patient communities across the United States over the past year. It's refreshing, it's helpful, and it's practical because patients have an innate sense of protecting themselves and one another. They need the information to act, and CDC has been quite helpful to AAKP over the past year and ongoing. Thank you.
Thank you so much, Paul and Richard. And thank you to those who are listening who completed our survey. We very much appreciate your comments, your questions. Those insights help us to inform this webinar as well as future webinars. So thank you for participating in that poll. I'd like to now introduce our guest speakers for today's webinar. Dr. Anna Cecilia Bardossi currently serves as Medical Officer on the Dialysis Safety Team in the Division of Healthcare Quality and Promotion at the Centers for Disease Control and Prevention. She joined CDC in 2018 as an Epidemic Intelligence Service Officer in the Prevention and Response Branch at DHQP. Dr. Bardossi received her medical degree from Universidad Nacional de Córdoba and completed an infectious disease fellowship at Hospital Privado de Córdoba, Argentina. Prior to her work at CDC, Cecilia worked in infectious disease research at a large academic healthcare institution in Michigan and as a hospital epidemiologist and infectious disease physician in Argentina. Her areas of interest are infection prevention, the control of outbreaks, and healthcare quality improvements. We're also happy to have Dr. Shannon Novosad joining us again today. Dr. Novosad is a medical officer with the Dialysis Safety Team in the Division of Healthcare Quality Promotion, Centers for Disease Control and Prevention. Dr. Novosad received her medical degree from the University of Alabama at Birmingham. In 2015, she came to CDC as an Epidemic Intelligence Service Officer assigned to DHQP, where she investigated outbreaks in healthcare settings. Her areas of concentration include prevention of central line-associated bloodstream infections and increasing the safety of patients on dialysis. We're so happy to have both Dr. Bardossi and Dr. Novosad joining us today. I turn things over to you, and please let me know when you're ready for your slides to advance.
Thank you, Erin, and thank you for the introductions. This is Cecilia Bardossi, and we are really thankful also for inviting us to speak today. We'll summarize critical information for patients for the prevention of COVID-19 and update you about COVID-19 vaccination. Some of you may already be familiar with information we'll present today, but we think it's important for us to review and to ensure will remain diligent and follow recommendations to protect ourselves and protect others. I wanted to begin today by reviewing the modes of transmission of COVID-19 and how the virus is spread. Understanding these and which are the most frequent modes of transmission can help shape our understanding of the most important protective measures we should be continuing to practice in the community and in dialysis facilities. The primary way COVID-19 spreads is from person to person and during close contact. The virus that causes COVID-19 appears to spread more efficiently than influenza, but not as efficiently as measles, which is among the most contagious viruses known to affect people. People who are physically near, within 6 feet of a person with COVID-19 or have direct contact with that person are at greatest risk of infection. When people with COVID-19 cough, sneeze, sing, talk, or breathe, they produce respiratory droplets. Respiratory droplets cause infection when they are inhaled or deposited on mucous membranes, such as those that line the inside of the nose and mouth. The next way that COVID-19 virus spread is referred to as airborne transmission. Some infections can be spread by exposure to virus in small droplets and particles that can linger in the air for minutes to hours. These viruses may be able to infect people who are farther than 6 feet away from the person who is infected, or after that person has left the space. There is evidence that under certain conditions, people with COVID-19 seem to have infected others who were more than 6 feet away. These transmissions occur within enclosed spaces with inadequate ventilation. Sometimes the infected person was breathing heavily, for example, while singing or exercising. Under these circumstances, scientists believe that the amount of infectious smaller droplet and particles produced by the people with COVID-19 become concentrated enough to spread the virus to other people. The people who were infected were in the same space during the same time or shortly after the person with COVID-19 had left. Available data show that it is much more common for the virus that causes COVID-19 to spread through close contact with a person who has COVID-19 than through airborne transmission. COVID-19 spreads less commonly through contact with contaminated surfaces. Respiratory droplets can land on surfaces and objects. It is possible that a person could get COVID-19 by touching a surface or object that has the virus on it, and then touching their own mouth, nose, or eyes. However, spread from touching surfaces is not thought to be a common way that COVID-19 spreads. And lastly, COVID-19 rarely spreads between people and animals. CDC is aware of a small number of pets worldwide, including cats and dogs, reported to be infected with the virus that causes COVID-19, mostly after close contact with people with COVID-19. However, at this time, the risk of COVID-19 spreading from animals to people is considered to be low. So now that we understand how the virus spreads, we'll discuss more about people who are at higher risk for severe illness from COVID-19, such as those with certain underlying conditions, such as chronic kidney disease. By severe illness, we mean someone who was hospitalized, admitted to the intensive care unit in a hospital, or that needed a breathing tube or machine to help them breathe, which is often referred to as intubation or mechanical ventilation due to COVID-19. The list of underlying medical conditions seen here is not exhaustive and only includes conditions with enough evidence to draw conclusions. It is a living document that may be updated at any time, subject to potentially rapid change as the science evolves, and was most recently updated last week. Healthcare providers sometimes advise patients with other medical conditions that they are also at high risk. So adults of any age with the following conditions are at increased risk: obesity and severe obesity, type 2 diabetes, chronic obstructive pulmonary disease, heart conditions, chronic kidney disease, cancer, immunocompromised state from solid organ transplant, sickle cell disease, pregnancy, smokers, and Down syndrome. Currently, there are limited data and information about the impact of many underlying medical conditions on the risk for severe illness from COVID-19. Based on what we know at this time, adults of any age with the following conditions might be also at an increased risk for severe illness from the virus. And the conditions are asthma, cerebrovascular disease, cystic fibrosis, hypertension, immunocompromised state, neurologic conditions such as dementia, liver disease, overweight, pulmonary fibrosis, thalassemia, and type 1 diabetes. Now, what do we know about COVID-19 hospitalization and mortality relative to age and underlying conditions? First, there are data showing that COVID-19 hospitalization increases with age. COVID-19 associated hospitalization has also been shown to increase with the number of underlying medical conditions, with the higher risk for adults with 3 or more conditions. This is important because we know that patients with chronic kidney disease often have other conditions that might put them at higher risk. And in relation to mortality, COVID-19 mortality rates are highest in older adults. And among persons hospitalized for COVID-19, the risk of in-hospital death also increases with age. In addition to the risk for hospitalization at the time of initial infection, patients may require ongoing care and need to be readmitted to the hospital. An analysis of more than 106,000 patients who survived COVID-19 showed that 1 in 11 were readmitted to the same hospital within 2 months of discharge. The odds of hospital readmission increase with age and the presence of 5 chronic health conditions: chronic obstructive pulmonary disease, heart failure, diabetes, chronic kidney disease, and obesity. Knowing about the underlying medical conditions that increase the risk of severe COVID-19, what general actions can people at higher risk take to reduce the risk of getting COVID-19? One of the most important actions is to get vaccinated. You should also encourage others around you to get vaccinated to protect themselves and you. Continue with normal care activities such as continue receiving your medicines and do not change your treatment without talking to your healthcare provider. And receive recommended vaccinations. And this includes not only the COVID-19 vaccination, but also other vaccinations such as influenza and pneumococcal. Other actions to take include limit your interactions with other people as much as possible. Consider avoiding activities where taking protective measures may be difficult, such as activity where social distancing can be maintained. In general, the more people you interact with, the more closely you interact with them, and the longer that interaction, the higher your risk of getting and spreading COVID-19. However, it is important to clarify that based on what we know about COVID-19 vaccines, people who have been fully vaccinated can start to do some things that they had stopped doing because of the pandemic, and this will be reviewed in more detail in the next presentation on COVID-19 vaccination by Shannon Mavosad. Do not delay getting emergency care for your underlying medical condition because of COVID-19. Emergency departments have contingency infection prevention plans to protect you from getting COVID-19 if you need care. Remember the importance of staying physically active and practicing healthy habits to cope with stress, and call your healthcare provider if you get sick and think that you may have COVID-19. And lastly, take precautions to prevent getting COVID when you interact with others. In this slide, we have those precautions. I know we have been talking about some of these since last year, but we think it is important to review them and reevaluate how to best adhere to these precautions, including when visiting dialysis facilities. Get vaccinated, wear a mask, stay 6 feet away from others, avoid crowds and poorly ventilated spaces, wash your hands often, cover coughs and sneezes, clean and disinfect, monitor your health daily. And we'll review some of these in detail in the next slides. One of the most important measures to take to prevent getting COVID is to get vaccinated. Authorized COVID-19 vaccines can help protect you from COVID-19, so you should get a COVID-19 vaccine when it is available to you. Another important measure to take to prevent getting COVID is to wear a mask. Some things to remember about masks. They should be worn in addition to staying at least 6 feet apart, especially around people who don't live with you. If you or someone in your household is infected, people in the household should take precautions, including wearing masks to avoid spread to others. Do not touch the mask when wearing it. If you have to continually adjust your mask and it doesn't fit properly, you might need to find a different mask type or brand. And make sure you can breathe easily. Here we have guidance on how to choose masks. There are many options, and this has been updated recently and may be different than what you have heard in the past about the best types of masks to wear. Do choose masks that have 2 or more layers of washable, breathable fabric, completely cover your nose and mouth, fit snugly against the sides of your face, and don't have gaps. I have a nose wire to prevent air from leaking out of the top of the mask. Do not choose masks that are made of fabric that makes it hard to breathe, for example, vinyl. Do not choose masks that have exhalation valves or vents which allow virus particles to escape. And do not choose masks that are intended for healthcare workers, including N95 respirators. And in relation to the cold weather, if you wear a scarf, ski mask, or balaclava, use them over your mask. They are not substitutes for masks. We just discussed guidance related to the use of masks, but we wanted to share a little about the science behind the types of masks that best slow spread of COVID-19 and why universal masking is recommended to slow the spread of COVID-19. CDC conducted experiments to assess 2 ways of improving the fit of medical procedure masks: fitting a cloth mask over a medical procedure mask and knotting the ear loops of a medical procedure mask, and then tucking in and flattening the extra material close to the face. Each modification substantially improved source control and reduced wearer exposure. These experiments highlight the importance of good fit to maximize mask performance. There are multiple simple ways to achieve better fit of masks to more effectively slow the spread of COVID-19. So all masks should cover your nose and mouth, fit securely under your chin, and fit snugly against the sides of your face. And in this slide, we also see some examples on how not to wear a mask. Don't wear your mask around your neck, on your forehead, under your nose, and this is something that is observed very frequently among people. Don't wear it only on your nose, on your chin, dangling from one ear or on your arm. And lastly, we just wanted to review the steps to remove your mask. First, carefully untie the strings behind your head or stretch the ear loops. You should only handle the mask by the ear loops or ties. Fold the outside corners together and be careful not to touch your eyes, nose, and mouth when removing. And wash your hands immediately after removing it. And recommendations on how to clean your mask are also included in the website shown on the screen. Reusable masks should be washed regularly, and they can be included with your regular laundry. This second study showed that mandating masks was associated with a decrease in daily COVID-19 case and death growth rates within 20 days of implementation. And allowing in-restaurant dining was associated with an increase in daily COVID-19 case growth rates, 41 to 100 days after implementation, and an increase in daily death growth rates, 61 to 100 days after implementation. So this highlights that universal masking and avoiding non-essential indoor spaces can help mitigate the spread of COVID-19. In this third study done in Kansas, they found something similar to the previous slide. The governor of Kansas issued an executive order requiring wearing masks in public spaces, effective July 3rd, 2020, which was subject to county authority to opt out. After July 3rd, COVID-19 incidents decreased in 24 counties with mask mandates, but continued to increase in 81 counties without mask mandates. County-wide mask mandates appear to have contributed to the mitigation of COVID-19 transmission in mandated counties. We just covered some very important information on universal masking, but let's now consider what it really means when thinking about mask use within an outpatient dialysis facility. It is very important that all people, including patients, caregiver, and staff, properly use masks for the safety of everyone in a dialysis facility. There may be moments when the mask may be removed quickly, but needs to be put back quickly. For example, when you have to take an oral medication with a sip of water. Another example is when you eat. Due to COVID-19, the facility may have developed new policies for when patients need to eat or drink within the facility, so try to adhere to them. You should only be eating or drinking during dialysis when it is medically necessary. So if you do need to eat inside the dialysis facility, the mask should be carefully removed while you're eating or drinking, and you should remask as soon as possible after eating or drinking. And ideally, when eating, stay at least 6 feet away from others before removing your mask. In a dialysis clinic, you are typically close to other patients and staff for several hours, so it is important that you feel comfortable speaking up and voicing any concerns you may have with how others wear their masks. For example, if you see that the patient who is sitting next to you or a staff member are wearing their mask under their nose, you should suggest him or her that they need to wear it properly. Because COVID-19 spreads mainly among people who are in close contact for a prolonged period of time, it is important to stay 6 feet away from others when possible, even if you or they do not have symptoms. Consider the following tips for practicing social distancing when you decide to go out. First, you need to know and follow the guidance from local public health authorities where you live. Then you need to prepare for transportation and try to consider social distancing options to travel safely when running errands or commuting to and from work or going to the dialysis facility. When using public transit or rideshares, try to keep at least 6 feet from other passengers. However, we understand that staying 6 feet away from others is often difficult on public transportation and rideshares. That is why CDC has issued an order that requires face masks to be worn by all travelers while on public transportation. Limit contact when running errands and stay at least 6 feet away from others who are not from your household while shopping and in lines. And if possible, use drive-through, curbside pickup, or delivery services to limit face-to-face contact with others. Choose safe social activities. It is possible to stay socially connected with friends and family who don't live in your home by calling, using video chat, or staying connected through social media. If meeting with others, please always stay at least 6 feet from others and wear a mask. It is safest to avoid crowded places and gatherings where it may be hard to stay at least 6 feet from others who are not from your household. And lastly, stay distanced while being active. And now going back to the dialysis facility, what does it mean to stay 6 feet away from others at the dialysis facility? It means that we need to be careful when using common areas within the dialysis clinic that may be busy. Some examples are the waiting rooms. In this case, you should choose to sit far from other patients. The scale station. This area can easily get crowded, so you should be careful to maintain the 6 feet distancing when waiting to use the scale. Restrooms and sinks. Depending on your facility, the restrooms or sinks where you wash your fistula or graft when you arrive for treatment may also be a busy place, so be sure to consider how you can maintain the 6 feet distance. Of course, dialysis stations should also be able to maintain 6 feet distance from a patient to patient. And if you are concerned about this, please talk with your care team. Their goal is to keep you as safe as possible, and conversation about COVID-19 and social distancing are very important. Make sure to communicate with your dialysis facility if you have been vaccinated and when, if you have had any COVID-19 symptoms since your last treatment or are experiencing symptoms currently, if you were diagnosed with or tested for COVID-19, if you have had close contact with someone with suspected or confirmed SARS-CoV-2 infection in the last 14 days. Symptoms of COVID-19 include cough, difficulty breathing, fever, chills, body aches, vomiting or diarrhea, or new loss of taste or smell. You need to watch for those symptoms. Some end-stage renal disease patients on maintenance dialysis report having some of these symptoms chronically or sporadically. It can be hard to tell the difference from COVID-19 symptoms, so it is important that you report any of these symptoms to your dialysis care team, even if you think they are chronic. The dialysis care team will decide if you need to be tested or dialyzed in a separate area until it is ruled out that you do not have COVID-19. Just some reminders about some other everyday practices. Remember to wash your hands before and after your dialysis treatment, as well as at any time you touch the outside of your mask while at dialysis. If you cough or sneeze while not wearing a mask, be sure to use the inside of your elbow or a tissue, discard your tissues, and wash your hands. And then about cleaning and disinfection, the dialysis staff will be cleaning and disinfecting the dialysis stations and other areas very frequently during this time, but you should also be aware of other surroundings in the clinic. On several of the previous slides, we touched on the fact that it is important to speak up, use your voice, and ask staff questions. This is an important aspect of your dialysis care at all times, but it is especially important during the COVID-19 pandemic. These may seem uncomfortable at first, but we have provided some samples questions here to get you started. What is the facility doing to prevent COVID-19 transmission? Have you been vaccinated for COVID-19? Do you mind cleaning your hands again before you care for me? Just to finish, this slide shows the CDC main website that you can access using the link included at the bottom of the page to review all COVID-19 recommendations and clarify any questions. And if you click on the More tab in the upper right, it will give you the option to view any new guidance and updates. Thank you. And now I would like to introduce my colleague, Shannon Novosad, who will present information on vaccination for COVID-19. Thank you.
Thanks, Cecilia. So in the 1 year since COVID-19 infections were first identified, multiple COVID-19 vaccines have been developed and put through clinical trials with the support of the U.S. government. So far, 3 have received an FDA emergency use authorization. As has already been mentioned, vaccination is a critical tool in bringing this unprecedented pandemic to an end, and CDC continues to work with states to understand roadblocks and figure out how to overcome challenges in distribution and administration to ensure that we're getting vaccines into arms as quickly as possible and safely as possible. As of March 9th, over 90 million doses of COVID-19 vaccine have been administered. You might have heard the term ACIP in the news, so I wanted to spend a few slides discussing what ACIP is and how CDC and ACIP work together. So the Advisory Committee on Immunization Practices, or ACIP, was established in 1964 by the Surgeon General of the U.S. Public Health Service, and it was designated a Federal Advisory Committee in 1972. The ACIP develops recommendations on how to use vaccines to control disease in the United States. Committee deliberations on use of vaccine to control disease in the U.S. include multiple considerations, which are listed on the slide here, including epidemiology of the disease, which is the study of the frequency and patterns of a particular disease, vaccine safety, quality of evidence reviewed, as well as economic and implementation considerations. Notably, the committee may revise or withdraw their recommendations regarding a particular vaccine as new information becomes available. And CDC is the secretariat for ACIP, but ACIP is independent of CDC, and voting ACIP members are not CDC employees. So the committee's recommendations are forwarded to CDC's director for approval, and once they've been reviewed and approved by both CDC and the Department of Health and Human Services, they're published in CDC's Morbidity and Mortality Weekly Report, also known as the MMWR. This publication represents the final and official CDC recommendations for immunization of the U.S. population. Under provisions of the Affordable Care Act, immunization recommendations of the committee that have been adopted by the director of the CDC must be covered by applicable health plans. This slide here shows the recommendations for vaccine prioritization that were issued by ACIP during the limited vaccine supply. I'm not going to read all of these to you. You're probably familiar with these and have heard these before. But as you can see, they're divided into different phases. So 1A, 1B, 1C, and then phase 2. And they're rolled out depending on characteristics of people in each of these phases. I think what's most important to know about these phases is that When they were made, it was always thought that there would be a level of local adaptation. So that's why you probably see things happening differently in different states. These recommendations are meant to be fluid and not restrictive for jurisdictions. And it's not necessarily to vaccinate all individuals in one phase before initiating the next phase, and phases may overlap. So again, many of you may live in states that are in various stages of prioritization, and some at this point have opened up vaccinations broadly and may be in phase 2, while others may be in states that are still in phase 1C, and others may be in states that have actually adapted these differently and are using different phases. These guidelines, kind of as covered in the previous slide, again, the prioritizations are not meant to be walls or barriers between the phases, but really were meant to be a way to prioritize people at high risk of exposure or severe disease during a limited vaccine supply. And we always anticipated that there would be overlap between these vaccination phases. The COVID-19 vaccination program is dynamic, and it will require ongoing reassessment as vaccine supply and demand and COVID-19 epidemiology changes to inform the timing of expansion to subsequent phases. And ACIP and CDC have endorsed the guiding principles of efficient distribution as well as jurisdictional flexibility for the COVID-19 vaccine program. COVID-19 vaccination is a safer way to build protection. Getting the virus that causes COVID-19 may offer some natural protection known as immunity, but experts don't know how long this protection lasts. The risk of severe illness and death from COVID-19 far outweighs any benefits of natural immunity, and vaccination will help protect you by building immunity without the risk of severe illness. So there have been 3 vaccines that have received emergency use authorizations from the FDA, listed here, Pfizer, Moderna, and the Johnson & Johnson. These vaccines were tested in diverse adult populations that included minorities and older adults, and all of the available vaccines have been proven effective at preventing serious illness, hospitalization, and death from COVID-19 vaccine disease. Importantly, it's unknown how long protection from receiving a COVID-19 vaccine might last. We realize that you may have concerns about the safety of these first COVID-19 vaccines because they use new technology. These mRNA COVID-19 vaccines were developed based on years of research. So while mRNA technology is new, it's not unknown. It's been studied for decades in vaccine trials for influenza, Zika, and rabies. And beyond vaccines, cancer research has also used mRNA to trigger the immune system to target specific cancer cells. These vaccines were able to be fast-tracked because research used existing clinical trial networks to quickly conduct vaccine trials. Another critical piece was the investment in manufacturing before COVID-19 vaccines were proven effective. mRNA vaccines are also faster and cheaper to produce because they use ready-made materials. And finally, FDA and CDC are working and worked quickly to prioritize review and approval of these COVID-19 vaccines during the pandemic. So like all vaccines, the mRNA vaccines have been rigorously tested for safety before being authorized for use in the United States. The technology is new but not unknown. They do not contain a live virus and do not carry a risk of causing disease in the vaccinated person. And the mRNA from the vaccine never enters the nucleus of the cell and does not affect or interact with a person's DNA. Some key facts about the COVID-19 vaccine are listed here on this slide. Importantly, getting vaccinated will help protect you from getting sick with COVID-19. People who have gotten sick with COVID-19 may still benefit from getting vaccinated. The COVID-19 vaccines will not give you COVID-19, and COVID-19 vaccines will not cause you to test positive on COVID-19 viral tests. One caveat to this is if your body develops an immune response, the goal of vaccination, there is a possibility you may test positive on some antibody tests. So COVID-19 vaccines are being held to the same safety standards as other routine vaccines. Several expert and independent groups evaluate the safety of vaccines being given to people in the United States. Before any vaccines receive authorization or approval, the FDA carefully reviews all the safety data from clinical trials. And the ACIP that we mentioned previously reviews all safety data before recommending use. After any vaccines are authorized and in use, FDA and CDC continue to monitor their safety, and existing systems can rapidly detect possible vaccine safety problems. These systems are being scaled up for COVID-19 vaccine introduction to fully meet the needs of the nation. And additional systems and data sources are also being developed to further enhance safety monitoring capabilities. One such system, actually 2 are shown here at the bottom of the slide. One is vSafe, which I'll talk about in the next slide. The other one is one that you may have heard about before, called the Vaccine Adverse Event Reporting System, or VAERS. It's a national system that's been in place for some time that collects reports from healthcare professionals, vaccine manufacturers, and the public of adverse events that happen after vaccination. So VSafe is a smartphone-based tool that uses text messaging and web surveys to provide personalized health check-ins after you receive a COVID-19 vaccine. Through VSafe, participants can quickly tell CDC if they have any side effects after getting the COVID-19 vaccine. And depending on the answers, someone from CDC may call to check on you and get more information. We encourage everyone who receives a vaccine to participate in VSafe. All you need to register is a cell phone. You can visit CDC's website for more information on the program. So before you get vaccinated, you should learn more about the types of vaccine and how they work. While you're being vaccinated, you should receive a paper or electronic version of a fact sheet specific to the vaccine you're being offered. And after you're vaccinated, you should be given a vaccination record card that tells you what vaccine you received, the date you received it, and where you received it. Your provider may also give you information about how to enroll in VSafe. And it's important to continue to use all tools available to stop the pandemic. So even after being vaccinated, continue to cover your mouth and nose with a mask, stay at least 6 feet away from others, avoid crowds, and wash your hands often. Before vaccination, providers should counsel patients about expected local and systemic post-vaccination symptoms. Depending on the vaccine product, the age group, and the dose, approximately 80 to 89% of vaccinated persons develop at least one local symptom, such as pain or swelling. And 55 to 83% report at least one systemic symptom, such as a fever or a headache. Most systemic post-vaccination symptoms are mild to moderate in severity, occur within the first 3 days of vaccination, and resolve within 1 to 3 days. COVID-19 vaccines may be administered to persons with underlying medical conditions who have no contraindications to vaccination. Some specific groups that get asked about frequently include immunocompromised persons, persons with autoimmune conditions, and people with history of Guillain-Barré syndrome, Bell's palsy, or dermal filler use. Clinical trials demonstrated similar safety and efficacy profiles in persons with certain underlying medical conditions, including those that place them at increased risk for severe COVID-19 compared to persons without these conditions. Persons with HIV infection or other immunocompromising conditions, such as a kidney transplant, might be at increased risk for severe COVID-19. They should receive the COVID-19 vaccine unless it's otherwise contraindicated. Regarding those with prior infections, vaccination should be offered regardless of the history of prior symptomatic or asymptomatic SARS-CoV-2 infection. And viral testing for current infection or antibody testing for prior infection is not recommended before vaccine. For those who have a current infection, vaccination should be deferred until they have recovered and criteria have been met to discontinue isolation. But there's no minimum interval between infection and vaccination. Since reinfection is uncommon in the months initially after infection, while vaccine supply remains limited, people with recent documented infection may choose to temporarily delay vaccination. For those that have received monoclonal antibodies or convalescent plasma, there's currently no data on the safety or efficacy of COVID-19 vaccine. However, it is recommended that vaccine be deferred for at least 90 days to avoid interference of the antibody therapy with a vaccine-induced immune response. So fully vaccinated people can, and before we say that, just want to make sure everyone understands what we mean by fully vaccinated. So that means at least 2 weeks after the second dose of a 2-dose series, such as Pfizer or Moderna, or at least 2 weeks after a single-dose vaccine. So again, fully vaccinated people can visit with other fully vaccinated people indoors without masks or social distancing, visit with other unvaccinated people from a single household if unvaccinated people are at low risk for severe COVID-19, indoors without masks or social distancing, and they can refrain from quarantine and testing following a known exposure to COVID-19 if they're asymptomatic. But please note that this refers to activities in the community. There may be different recommendations for the healthcare setting. For example, it is still recommended that in settings such as dialysis centers, that fully vaccinated individuals who have been exposed need to be isolated and cared for using appropriate precautions. These recommendations are reviewed frequently and will be updated as more information becomes available. This slide just gives a little more detail on what vaccinated people can do compared to unvaccinated people, and I'll read some examples. So for example, fully vaccinated grandparents can visit indoors with their unvaccinated daughter and her children without wearing masks or physical distancing provided none of the unvaccinated family members are at risk for severe COVID-19. A second example, if a fully vaccinated individual visits with an unvaccinated friend who is 70 years old and therefore at risk of severe disease, the visit should take place outdoors, wearing well-fitting masks and maintaining a physical distance of at least 6 feet. And then continuing this example, if fully vaccinated grandparents are visiting their unvaccinated daughter and her children, and the daughter's unvaccinated neighbors also come over, the visit should then take place outdoors, wearing masks, and with physical distancing. This is due to the risk that 2 unvaccinated households pose to one another. Running short on time, so I'm not going to read through all of these because I think we reviewed these, but here you can see where fully vaccinated people should continue to do. And this just talks about some of the scientific evidence behind why we make these recommendations. And it has to do with the risk of transmission of disease and development of severe disease from those who have been vaccinated. And I just wanted to point out that there is a science brief on the CDC website that's continuously updated. So a good idea to keep an eye on that to better understand where the recommendations are coming from. I think I've covered all this as well. So I just want to talk a little bit about the variants. So what is a variant and how does it occur? Viruses are constantly changing, including SARS-CoV-2, which is the virus that causes COVID-19. Changes in the genetic code of a virus are called mutations and naturally occur over time when an animal or person is infected. These mutations can lead to the emergence of new variants that may have different characteristics. So while a certain amount of genetic variation is expected to occur as SARS-CoV-2 spreads, it's important to monitor circulating viruses for key mutations that happen in important regions of the genome. Many mutations do not affect the virus's ability to spread or cause disease because they do not alter the major proteins involved in infection. However, variants with mutations that enhance the virus's ability to spread or cause disease are able to outcompete other variants. This slide here shows just 3 of the circulating variants, but probably the 3 that you have most likely heard about in the news. But really what I wanted to emphasize here that while these are the current variants of concern, there may be others or more or different variants could be targets in the future. And then this table here shows in the US the same 3 variants that were on the prior slide. So you can see as of March 7th how many cases have been reported in the US and how many jurisdictions are reporting these cases. The one most frequently reported has been B117, which was the UK variant with around 3,000 cases. We're still learning about variants and what they mean in terms of disease severity. In regards to the UK variant, this variant spreads more easily and quickly than other variants. In January of 2021, experts in the UK reported that this variant may be associated with an increased risk of death compared to other variant viruses, but more studies are needed to confirm this finding. It has since been detected in many countries around the world, and as shown in the previous slide, this variant was first detected in the US around the end of December 2020. In general, these variants seem to spread more easily and quickly than other variants, which may lead to more cases of COVID-19. An increase in the number of cases will put a strain on healthcare resources, lead to more hospitalizations, and potentially more deaths. So far, studies suggest that antibodies generated through vaccination with currently authorized vaccines recognize these variants. This is being closely investigated and more studies are underway. Some preliminary data suggest that some COVID-19 vaccines approved for use outside of the US may be less effective against the variant first found in South Africa. Some data on the vaccines approved for use in the US, I'll read here, not on the slide, but include Pfizer. And so the preliminary results from the UK demonstrate that vaccination with Pfizer vaccine was highly effective in the high 80s against SARS-CoV-2 infection and symptomatic COVID-19 during a period when this was the predominant circulating strain, so the UK variant. And similarly, Pfizer also has high effectiveness against infection in Israel when there were multiple circulating strains, when the proportion of the UK variant was increasing to around 80%. And for the Johnson & Johnson vaccine, preliminary data suggests that this vaccine may have some reduced overall efficacy against some of the variants, particularly the South African variant. But in the United States, efficacy was 72%. But in South Africa, again, efficacy was only 64%. However, important to know when you're thinking of these numbers that this vaccine efficacy against severe disease was very high and similar across all sites, including the US and in South Africa. CDC will continue to monitor these new variants for any impact on real-world vaccine effectiveness. and COVID-19 vaccines continue to be an essential tool to protect people against COVID-19, including new variants. And one of the best ways that we can impact the development of these variants is by encouraging vaccine use so that the variants have less time to develop and circulate. Those are the end. I think we hopefully have time for a couple of questions. Sorry that we ran a little bit over, but thanks, Erin. Back to you.
Thank you so much, Dr. Novosad, and thank you, Dr. Wardosi, for a great presentation. We do have a number of questions that came in, and several of them are regarding concerns that some kidney transplant recipients have. So I will get right into those. A recent article was published in the Journal of American Medical Association, which indicated that transplant recipients who are vaccinated are not building antibodies quite like the general population is. Can you speak to that? Why are transplant centers not testing for antibodies post-vaccination? What can transplant recipients do? And does this affect their susceptibility to getting some of the variants that are out there?
Yeah, I think those are all really good questions, and I think I'll say some more, but I do think the short answer is we don't know what that means yet, and I think we're still learning. In general, antibody testing is not, currently recommended to assess for immunity following the vaccination, really because we don't understand exactly what a positive or negative result would mean. And there's actually a few reasons for this. One is that there's so many different antibody tests on the market, and they all have variable sensitivity and specificity, and they just haven't been studied in this way. So it's hard to know what an actual titer or number means on the antibody response. Additionally, the immune response has many components, and the antibody response is only one part. Again, I mentioned the level of antibody protection has not been established, and antibody testing doesn't evaluate some of these other parts of the immune system, such as a cellular immune response, which also likely plays a role in vaccine-mediated protection. And then I think probably the other thing that's important that I kind of mentioned a little bit was that there are, again, several types of antibody tests. And if the test isn't looking for the right antibodies, it may not detect an immune response resulting from vaccination. And patients or providers may not always know what type of antibody test they're ordering or exactly what types of antibodies are being tested. So I think that's a long answer to give us several reasons on why we just don't know what the antibody testing means now, which is why it's not really being done widespread or being recommended. I think the caveat to that is that could change as we learn more and can really refine our understanding of what an antibody test means.
Thank you so much. And I think it's probably a good idea to reiterate here what you've been saying, that even if you have received your full the full vaccination, it is important to continue to mask and socially distance when you're out there in social settings and healthcare settings.
Yes, that's very true.
We have a couple of questions regarding immunosuppressive medications that transplant recipients are. Is there any data out there about how this may impact vaccinations or how the vaccination might impact immunosuppressive meds? Does it limit the efficacy of the vaccine?
I'm not aware of any current data that says that, and I think in general for other vaccinations that we don't necessarily have evidence that the vaccine itself is interfering with kind of the efficacy of the medication. It's generally the concern goes the other way, whether the medication will interfere with the efficacy of the vaccine. So I think the short answer is no, we don't think so right now. But again, I think all of these are really good questions because there's still so much that we have to learn about this particular vaccine and this particular disease. And no, I think I did have one slide on vaccine and immunocompromised persons. And I think the key for that is we do get questions a lot about, if people are on some particular types of immunosuppressive medications, should they not get vaccinated? Is it not going to work as well? And definitely reiterating that there's no reason to hold vaccine while you're on a particular immunosuppressive medication, but just important that your provider or whoever is giving you the vaccine kind of knows your medical history and knows all of those details.
Absolutely. Thank you. And we'll close up here with a final question. Is it true that companies like the Moderna and Pfizer that have developed vaccines are kind of retailoring their vaccine to protect against these variants? And if so, will the public be notified when those vaccines are available? And are they going through a similar trial process for those?
Yes, so definitely the vaccine manufacturers are currently engaged in a number of different studies or projects to answer questions about the vaccine, including, how long the duration of immunoprotection may be after vaccination, whether boosters are needed, and then also the very important questions of how effective the vaccines are against particular variants. And so, yes, all of that's definitely being looked at, and I think the public will be notified pretty quickly if any need is for an update for the vaccine or a booster. I do think that's one thing that I've been very pleasantly surprised with, I would say, throughout this process of vaccine approvals and studies, as I do think that the FDA and the manufacturers and other groups have done a really great job keeping the public appraised of their work and getting results out there as quickly as possible. So I think the same will happen for this ongoing work, including the work against the variants.
Great, thank you so much. Again, I want to let everybody know this webinar has been recorded. We will post it on our website. If there were any questions that we were unable to respond to, please reach out to us at info@aakp.org, and we will respond. I'd like to go ahead and close with a few slides on information that may be of interest to you. We encourage you to join AAKP as a free member. We have free membership for kidney patients, family members, and living kidney donors, and you can join online or by calling us. We also ask that you follow us on social media if you have social media accounts. Please also remember to share your email address when signing up with us, and you will be notified by email when opportunities arise where your opinions and experiences are needed to help inform innovation, advance care, and make a meaningful impact to improve lives. AAKP is dedicated to helping patients understand their condition and take control of their health care. We are proud to offer a variety of resources for both patients and caregivers, and you can visit our website at aakp.org, click on the AAKP store button at the top of the homepage, and you can either order brochures or you can download them onto your computer. We hold a number of events throughout the year, and we hope you'll join us. Here's some save the dates for this year. We have our Global Innovation Summit, May 13th and 14th, our Annual Policy Summit on June 17th, and our National Patient Meeting, September 24th and 25th. We hope you will join us. Registration is free, and all of these events will be virtual, and our sessions will be recorded. And if you'd like to view some recorded sessions from our previous events, you can visit our YouTube channel. We are continuing to update our coronavirus resources webpage. We'll also post our webinar recording on that page as well. And again, I'd like to thank you, send a big thank you to our speakers today, Dr. Cecilia Bardosi and Dr. Shannon Novosad, for sharing with us this very important information and updates on the COVID vaccine. We appreciate your time. Thank you so much for working with us over the last year. And we look forward to hearing more and seeing more progress with everybody getting vaccinated and hopefully returning to a more normal time very soon. Again, if you have any questions about what you heard on today's webinar, please send them to info@aakp.org, and we will work to provide a response to those. Thank you again, everyone, for joining us today. Be informed and stay safe.